They have identified 4 factors that are involved in acquiring depression. So there's a genetic predisposition. They believe that if there's a family history of depression, then the chances are that the child or the children will also get depression. But that's not always the case, of course. If a child has a happy home life, even if they do have a history of family depression, then you've got to hope that that's not going to happen. Some people may be more at risk because of their personality. People who worry a lot, people with low self-esteem, low self-confidence, people who are perfectionists, that A-type personality. But for our children, they worry. They worry about what's going to happen next. That's one of the big things. If they're not living in a place where there's structure and routine, I guess they worry about what's going to happen next. What are we going to do? I really should get my son Seth to have a talk about this, because he's a big worrier, and he'd be able to express it a little bit more comprehensively than me. So people with serious medical conditions or illnesses are more likely to get depression. We can understand that. I think we've probably all had some sort of illness in our lives, and it does get depressing. You wonder if you can cope with work, or how you're going to manage the housework, how you're going to cook the dinner for the family. Even in some cases, are you going to live? So yes, that's clear. And drug and alcohol abuse, and that's like the chicken and the egg. If people are depressed, then do they take to alcohol to hide the depression, or do they drink alcohol and then become depressed? They're not really sure about that one. Just like depression, anxiety can be caused by several different factors as well. And those factors are external and environmental factors, such as trauma, abuse, victimisation and stress at school. Medical factors, again, a serious medical condition, or the side effects of medication. Now, I didn't know that myself. I didn't realise that the side effects of certain medications can lead to anxiety. They can also be symptoms of an illness. Substance abuse, such as cocaine or amphetamines, or withdrawal from drugs, can also cause anxiety. Genetics, again, they're pretty similar sort of factors. A family history of place. There we go. Sorry about that, ladies. Okay. I'm going to try and put my computer down somewhere. If I go off again, I will walk around the place until I can find a signal. I may have to get up on that roof, Louise. So genetics, again, a family history, and brain chemistry. So certain people have abnormal levels of certain neurotransmitters in their brain, and they're more likely to suffer from anxiety. And because we know that prenatal alcohol exposure is a brain-based issue, then it could be that that's a factor, or a big factor, in our children getting anxiety as well. So for children with FASD, many of these factors will come into play. So it's not just, if you avoid this or avoid that, our kids won't get it. It's just something that looks like, there are so many different reasons why it's possible that children with FASD will have depression and anxiety that maybe it is unavoidable. One thing that I was thinking of in terms of family history, family history of substance abuse, and it creates fetal alcohol spectrum disorder, and that condition then creates substance abuse, then I wonder if they consider that to be a family history of anxiety and depression before we understood what FASD was in fact. Anyway, yeah, so it's really important to try and avoid depression and anxiety. I think I've said this so many times, but just reading and researching on this, it just may not be. We may be very lucky if we can avoid it in our children. But if it can't be avoided, medication is really critical. I believe absolutely in medication. I know that it's an evidence-based intervention, and I also know that it's important to prepare the child for the fact that the first medication that they go on might not be the one that is actually going to work. What happened to me was we went so many times to the doctors with no result that Seth refused to go, even when he really needed to, and we don't want that to occur. So it's better to prepare the child that, you know, this might not work, but we'll go again and we'll keep trying until something works. Once mental health issues come into play, the whole condition becomes much more complex for both the parents and the medical practitioner. It's almost a certainty that the first type of medication that doctor trials will not work. It's just a matter of trial and error, like I said. Please don't be reluctant to put your child onto medication. It really is critical. I've said on several occasions that the secondary disabilities can often be more complex. I think I've been through that, and more damaging than the primary disabilities. It's certainly when children are teenagers and when they get older, it is certainly very difficult to tease out what is actually a secondary disability or a mental health problem and what is actually the cognitive impairment of FASD. Anxiety will often come first, and that usually happens when children with FASD enter school. Regardless as to whether they have a diagnosis, teachers are still rather reluctant to treat our children fairly by treating them differently. So many people still think that fair means equal, and that is never ever the case. School is where the problems will start unless you haven't known that your child has FASD in the first few years. Counselling can work if the counsellor understands cognitive impairments and knows to use the right type of words, short sentences, and to clarify that the child understands what they're talking about. And I know several parents who do use counselling for their young children, and they have found it to be helpful. So if you're thinking about it, it might be worth trying. There is a program in the United States called Friendship Training, which has been proven to be very successful for children with FASD. It teaches them social skills for interacting with peers, and we know that that's one of the issues that our kids just find so hard, is that social interaction. And if they can be taught how to do it, then of course that's going to make a big difference to how they perceive school and whether or not they actually get depression and anxiety. Executive functioning training can improve self-control, reasoning and understanding cause and effect. Often children with FASD will need help with their studies as well and may need a tutor. However, again, they need to understand that the child has a cognitive impairment, has some disability, and may not understand certain concepts. Otherwise, it might be just a waste of money, or at worst, it might mean that the child has another opportunity to feel bad about themselves. Excuse me, I'm going to get some water, so I'm going to very slowly move you over here. Get some water. Put you down. This is certainly not as good as it was in the office. Oh, I do apologise. Parents and siblings also need to help in dealing with these challenges as well. Siblings of any children with disability are going to feel maybe left out, and maybe it's worthwhile checking to see if they, are suffering a little from depression and anxiety. I know Triple P now has training out for parents and carers of children with FASD, and I have heard that it seems to be, quite reasonable. They use the reasonable strategies, so that might be worth doing. I think that's free, actually. And also Diane Melbourne. For those of you who haven't heard of Diane, she's very active over, or has been very active over in the United States with FASD. She started her group FASCETS, FASCETS, in '97, and she's developed a program called NAFB and NBFA, neurobehavioural fetal alcohol, something like that. I may have those letters around the wrong way. But what she does in her program is she identifies specific issues that the child is experiencing. So there's a long document that needs to be filled out by the parents. I don't know if you've seen the RFF-ADA screening tool, but it's sort of similar to that. And so she identifies specific issues and then works on specific interventions. So, for example, I attended one of her programs over in the States, and this is what I remember of it. You guys, Louise and Berta, you're probably already certainly doing a lot of this yourself because you're very proactive. But for example, this is how Diane's program works. After completing that form with detailed information about the child's behaviour, then you look at one of those behaviours. So, for example, if the child is having trouble understanding what's required for homework, the program asks what is required for that child to understand. What is required is faster processing, good comprehension, clear understanding, and all of those we know our children have trouble with. So what else can be done? Well, the teacher could take the child with FASD aside and explain the homework to the child on a one-on-one basis. The teacher could write it out on the whiteboard or blackboard or whatever. The teacher could run through the homework with the child. So any of those possibilities may improve that particular part of the child's life that they're finding difficulty with. So I guess in reality you identify the issues specifically as to what's happening with the child, and then look at what's needed for that child to manage that particular issue, and then look at how we can supplement, how we can